Violence continues to flare up in many communities across the country. Many trauma teams are on standby to care for patients in a critical time.
Yeah, as medical reporter Liz Bonus explains, that's never easy, but it's especially difficult during a pandemic.
Hey guys, hello to you. This pandemic has taken its toll on our health in a number of ways, but as violence has continued to erupt in many places, caring for those who are injured can have double the danger. Not only do trauma specialists and mass casualty teams need to repair wounds, they need to protect themselves and others from this coronavirus. From Kalamazoo to Chicago, Portland to Cincinnati. As violence erupted this past weekend, trauma teams were standing by.
So as we start to get word of an incident unfolding, we start to scale up the response.
Dr. Timothy Pritts is a trauma surgeon at Ohio's University of Cincinnati Medical Center. His mass casualty team had to care for as many as 18 who were wounded this weekend in several shootings in the area. So, were you there on Saturday night? How do you feel about the way your team handled this?
One of the challenges of this one is this response, again, was a number of individuals came really almost all at the same time.
And with a number of individuals coming in wounded, not only is critical care needed, protection for everyone involved is also needed now against the COVID-19 coronavirus.
It leads to an increase in the level of overall stress, just the additional personal protective equipment that we're all wearing because of the pandemic makes it a little bit more difficult to operate in these conditions.
Dr. Pritts admits that while the team is trained in trauma,
we practice for this, we drill this repeatedly.
They also have to do everything possible to minimize risks right now, to those who need care and to those who provide it.
And we're always cognizant that when we're taking care of patients that they are having the worst day of their life. And so we really want to bring the best possible care to each of them and treat them each as if they were our neighbor, our friend, our family member, and help them through these, what's really a very difficult time in their lives. And we're aware of that every day.
Now, the amazing part in all this, that Dr. Pritts says his team always rises to the occasion, pandemic or not. But he says while we remember those on the front lines caring for those who need treatment for the virus, we also need to remember those who are providing all kinds of much needed care right now, who are in just as much danger on the front line from COVID-19. I'm medical reporter Liz Bonus. We'll throw it back to you.
Thank you, Liz.